here to talk about addiction after hours. I'm Alyssa. This is Nick, Katie, Lynsey, and Miles. So imagine this. A 65-year-old man is taken to the hospital by ambulance. He states that he is in a lot of pain, and this pain is the same pain that he was admitted to the hospital previously. He's been through multiple surgeries, and he states that this pain is the pain he felt before those surgeries. Eventually, he's admitted to a unit in the hospital where he goes through the traditional routine: IV fluids, antibiotics, a number of consults to different physicians, trying to figure out what the source of this pain is. Unfortunately, the source of the pain can still not be located, but he still states that he needs his pain medications and that the pain is not going away. Eventually, he is released from the hospital, but upon discharge, the RN calls the attending physician and states that this patient is a frequent flyer and his past medical records dictate that he is a pain medication seeker. The RN recommends that the doctor does not increase his home meds, but the doctor disregards the RN's opinion and still increases it. So the point of this is that the patient went home with an increased amount of pain medications to only return in another month to have those increased again. The problem is that this patient was never warned about the possible addiction of the pain medications with his initial surgery. So the more times he came into the hospital, the more his medications increased, encouraging his addiction.
So our main focus is to make sure that the patients who are about to undergo surgery are aware of the dangers that come along with the pills that will be prescribed, as well as the warning signs of addiction, so that if a problem arises, they can take immediate action to resolve the issues. Our solution is an interactive course that educates the patients on the warning signs, dangers, and what actions to take if problems do arise.
So our target market would be to hospitals and outpatient facilities that write prescriptions for their patients post-surgery. Many of these facilities already have pre-existing education that the patient goes through prior to the operation, but according to our professor, Coach B, he stated that none of these pre-operations touch on prescription pills and their usage. It is pretty crucial for people to understand whether they should be taking Tylenol or Advil rather than hydrocodone or any of the severe or strong pain medicine. Also, the hysterectomies are one of the 11 surgeries that are the highest prescribed for pain pills, with an average of 40 pills prescribed per patient. On average, only 18 pills are taken. So that leaves a big void in the market for these patients to be informed on what to do with their pills after they are done taking them. Our end user scalability for hospitals with 200 to 300 beds, they average about 8,500 surgeries per year, and with 10% of people that are prescribed opioids, nearly 10% of them are still on them 3 months after the operation. So we would be able to make a big dent in people getting addicted to these prescription pills.
For product differentiation, many hospitals tend to do different things. Hospitals such as Deaconess, IU Health, and St. Vincent tend to give their patients pamphlets or binders of what to expect pre, during, and post-surgery. The Addiction After Hours interactive program will help patients become more informed, more education, and just know more knowledge of what to expect after the surgery. With this, the program would help the patients know what to do after, the resources they need, and what to expect after.
For patients who are about to undergo surgery, need to be made aware of the possible dangers that can arise when prescribed pain pills. Unlike what is being done currently, After Hours will help provide and better educate people who are prescribed painkillers.
All in all, we think that the Addiction After Hours interactive program will help patients understand and become more educated and reduce the amount of people who have post-surgery addictions.
Yeah.
All right.